When injecting medications, we must first fill out the MARs and check the patient's allergies against the MAR. After we assess a medication and the patient's health history, we must keep the 8 rights of medication in mind. Those rights are the right medication, the right dose, the right patient, the right route, the right time and frequency, the right reason, the right documentation, and the right to refuse. To confirm the right patient, we must perform 3 checks for identification. Check the MAR against the patient's ID bracelet, ask the patient to state their name, their full name and date of birth, and many agencies use a wireless barcode scanner to identify the right patient. Our patient is Mr. Mancini, and he has an average body build, very lean, with well-defined muscles and a low body fat percentage. First, we are going to perform a subcutaneous injection. For subcutaneous injections, we use a 25 to 27 gauge needle, which is 0.38 to 0.63 inches in length. Syringes come in a variety of sizes ranging in capacity from 0.5 to 60 milliliters. When choosing a syringe, choose the smallest size possible to improve the accuracy of the medication preparation. Since the dose of heparin is 5,000 units per 1 milliliter, we're going to use a 1 milliliter syringe. The needle is inverse to its diameter, so the larger the gauge, the smaller the diameter. Next, I'm just going to perform hand hygiene and clean off the top of my vial with an alcohol swab. Next, I'm going to fill my needle with air, the same amount that I would, that of liquid that I'm going to be taking out. And then at 90 degrees, I put it straight in the middle and inject the air. Flip the vial, and with one hand, I fill just over 1 milliliter to leave room to get rid of air bubbles. I take it out, then I get rid of the air bubbles. Make sure all of the air bubbles are out, and then push until it goes to the 1 milliliter line. Perfect. Now we're going to recap the needle with the one-handed technique. Just stick it in, pop it up, and recap. Now I'm going to label my medication with the patient's name, the date, and the type of medication. For an intramuscular injection, we use a 20 to 25 gauge needle with a 1 to 1.5 inch in length. So now I'm going to drop the dose out of a vial. So first I'm going to put on a filter needle that will filter out the glass particles of the ampule when I break it. So to protect myself, I'm going to use an alcohol swab instead of just my fingers when I break the glass. First we get all of the medication out of the top, and then I break it away from me. And then dispose of the glass in the sharps container. So I take the cap off of my filter needle and then draw up the dose, which is 1/2 milliliter. So I'm going just above 1/2 milliliter. save room for air bubbles. Get rid of all the air. Bring the line to half. And recapping with the one-handed technique. Okay. So now I'm going to be changing the filtered needle to the needle I'm injecting my patient with, because you never want to inject with a filter needle. It is huge. Unscrew into the sharps and then replace with the real needle. And now I'm going to label this as well as Hadol. It's an antipsychotic. There we go. Next, I'm going to confirm my patient ID and explain the procedure to the patient. After we confirmed our patient ID with the 3 ways I talked about earlier and clearly explained the procedure to the patient, we're going to landmark injection sites. For the first site, we're going to be landmarking for the subcutaneous injection. So we want to go 2 inches away from the belly button and grab a nice fatty piece of tissue. Next, we're going to find the injection site. So we go 2 inches away from the belly button and grab a nice piece of fatty tissue. And we're going to we're going to palpate the site for any masses. There's no masses, and this looks like a good injection site. Next, we're going to clean the injection site with an alcohol swab. And inject at a 45-degree angle. And with one hand, we're going to squeeze out the medication at a slow, constant rate. Perfect. Pull out, dispose of in sharps, and then cover to make sure there's no bleeding. So for the intramuscular injection, we're going to use the deltoid. So we go to the top process of the shoulder, go 2 finger lengths down, and then we spread the skin. After finding the site, I'm going to make sure there's no masses. So I inspect and I palpate just to double check, and there's no masses, there's no obvious lesions or anything like that, deformities. So this looks like a good site. Next, we're going to do the IM injection. So again, we clean off the site with an alcohol swab. This time, instead of pinching the skin, we spread the skin. And instead of a 45-degree angle like the subcutaneous, we go in at a 90-degree angle. Nice and firm. 1, 2, 3. Squeeze in the medication. Pull out and then let go. Dispose of in sharps and then cover with an alcohol swab. The stretching and let go and letting go is the Z pattern. After I cleaned up my mess and I performed the injection, I'm going to document next. So I document that I did the injection and the time and location on the body of where the injection was performed.